Joining me today on the podcast is Dr. Neeraj Puri, who is an integrated dentist, an experienced dentist in general dentistry, but now focusing a lot more on dental implants and periodontal disease. Have I got that right?
You have, Charmaine. Hello.
Very, very excited to have you on here. And I think probably one of the first things people are going to be wondering is why on earth I've got a dentist on a podcast talking about longevity and health span.
Absolutely.
So that's going to be one of the kind of key things we'll be dipping in today. But I'm going to start with a statistic actually from a study in the BMJ in 2019, finding that severe gum disease is linked to 70% higher risk of heart disease. Is that a statistic you've come across or you've heard of?
So this is something that's been talked about a lot over the years, and people have become more and more aware of the link between. So whilst we talk about gum disease and heart disease, it's really chronic inflammatory disorders we're talking about, because gum disease is actually an inflammatory disorder. It's a disease. People don't realize that. They think it's just an issue with teeth, but it's much more than that.
And that's really interesting because that's probably one of the key areas where it is going to tie into health span and lifespan. Is inflammation is one of the biggest drivers of accelerated aging. So, that's going to be a really interesting way to look at what's happening in your mouth, because I think your mouth is not just for eating and talking, is it? It's the gateway to...
I think this is really interesting because you and I have spoken about this in many times. We always seem to treat, especially in this country, different aspects of our body in isolation. And we think of the mouth as completely different from the rest of the body. But remember, it's the opening to the rest of your body. So we have to think that whatever's happening in the mouth is actually having an impact on our general health as well.
And I think a lot of people are familiar with the gut-brain axis, the communication that's happening between the gut and the brain. But more and more now, when I'm, looking at research, they're saying, hold on a second, we should be talking about the oral gut brain axis. So there is some communication also that's happening between the oral cavity and the brain.
One really interesting thing, and I'm sure you talk a lot about this, is, we talk about our perception, our being through the brain, that our awareness is through the brain. But what we've realized more and more is that the gut actually has much more nerve endings. So that, now they even say it's like your second brain, could even be your first brain. It's actually controlling everything. And I find that really fascinating. So when you have impacts when you have an impact in your gut, if you have discomfort or you have problems with your gut, this is really your domain, Charmaine, but I'm just dipping into it a little bit because I find it really fascinating. It's because you could have inflammation, you can have lots of things going on, emotional things going on, and that gut, that that membrane, the GI tract is part of the mouth. So when we have something happen, we have some kind of assault, say some kind of inflammation, it will impact the whole gut.
That is really interesting. And I think, there's been a lot of emphasis. I see it in my practice when people come in, there's a lot of awareness of the gut microbiome. So people are super aware of what's happening within their gut. But they may not be so aware of what's happening in the mouth. And that is also an ecosystem with gut bacteria and gut microbes.
And do you think part of this is possibly because we look at more kind of symptom-based practice? So historically, that's what we've really focused on, haven't we? People have an issue, we try to hone in on that issue rather than stand back as a profession and say, wait a minute, why has this happened? What are the steps that might have led up to this? So when we are looking at the gut, you're absolutely right. It has its own kind of microbiome. The mouth also, the difference with the mouth is that you have an opening to the outside, so you have an impact from the environmental side as well, what's happening. And then obviously you're eating food, so you're bringing in lots of foreign stuff as well.
And there has to also be an impact on the immune system, I would imagine, with it being, like you say, an opening to the outside world. It is in some ways immunologically really important as well, because your immune system has to be very primed and aware of things that may be entering the mouth.
And again, because our food is changing, so as a species, we are comfortable with certain things that we're eating. Obviously, we don't know in our own generation, but this will be over many, many generations. We've adapted to be able to eat things, and that will have an impact on our biology, on the kind of bacterial loads that we're carrying, which we live in synergy with. But the foods over the last probably 100 years, probably even less, maybe 50 years, has changed rapidly, because we're influencing food because we're trying to grow it in a faster way. We're packaging in a different way. So it's more unnatural. But our biology hasn't had a chance to catch up with that.
That's a really interesting point. And I think once before you mentioned that there's also structural changes that have happened over time in the shape of the jaw. And is that correct? Because of the food that we're eating?
Yeah, so interestingly, when we look at generational changes, what they say is that over the last 300 years, there's been a massive change in how our jaw structure has actually started to distort. So we used to have much more well-developed jaws because the diet that we were eating was much more fibrous, required much more chewing. So it meant that our jaw structure was much stronger. And the interesting thing, and this is a conversation I have regularly with my own patients, is that, remember, bone adapts to whatever trauma that you put on it. It's not like wood. So if you're putting something in wood, it will stay there. Whilst if you press on bone, it will actually interact. And so when you're eating food which is soft, because that's the food that we're eating just now, the bone is actually starting to adapt because your brain is primed to try to reduce energy loss and wastage. So if we don't need it, we won't get it. So now what you're finding is that the jaws are actually becoming smaller and smaller, and you're getting much more malocclusion, which is where people have teeth which aren't aligned properly. Even if you look at your palates, especially in the northern hemisphere, you'll see that the palates are much, much higher, which means that we tend to not breathe so well. So when you see children, sometimes you can see that they walk around with open mouths. Didn't have that happening before so much. And so part of this is maybe an understanding from the profession side as well, but part of this is things that we're adapting to. So our food has had a big impact on what's actually happening to us in terms of how we now tend to breathe through our mouth much more. So then that has an impact on your general health.
Yeah, I think one of the things, one of the topics we generally explore quite a lot on this podcast is breathing, because it has got such a big impact on, especially on the nervous system as well. So you're saying that the change that has happened in our jaw structures could actually be impacting our breathing as well.
If you look at the fact that the palate is higher, which means now that there's much less space between the palate, which is then the floor of the nose, isn't it, and the nose, you don't have enough space to grow, have that volume of air go through the nose. So you need to have some way of breathing a bit better. And so what's happening is if you then look at the back of your throat as well, you have something, if you open your mouth really wide, it's called a uvula, and it hangs back. And so even looking at things like that, that's something that a dentist can identify as part of their examination. That is restricting. The position of that can also restrict how much airflow you're having. So then people get into the habit of breathing through their mouth, and the mouth isn't actually designed for that, because we have lots of mechanisms in the nose to be able to filter air better and in terms of the energy as well. So when we're breathing through the mouth, we're dehydrating as well. So there's lots of things that are going on because we're breathing wrongly.
It's interesting. We've had lots of conversations over the years, but it's quite unusual to find a dentist who is so aware of that whole body system, and not just looking at it as an isolated system, as you said before. So, why do you think dentistry is so separate from what we're doing in terms of medicine? Because again, if we go back to the stats, if there's gum disease, there's the potential higher risk for heart disease, but also we know there's a correlation between diabetes and gum disease as well. And then, of course, very interesting studies around Alzheimer's disease, brain health, and certain bacteria growing in the mouth. So there seems to be, and like you said earlier on, inflammation in the mouth is not just isolated in that area. It can be a systemic issue. So for me, it seems that our dentistry is very reactive, and we're not, we're not looking at the whole system.
That's a very interesting point you're making. But if you look at the profession in general, even in medical terms, we are reactive. We're waiting to see things go wrong before we try to correct things. And what are we correcting, really? We're never putting things back the way they were. We're trying to rebuild things. So dentistry is surgery, and people never think of it in that way, but that's what you're doing. So you're just trying to repair something. What you've got in your mouth is a miracle of evolution. We're not even anywhere close to being able to create something like that. If you look at the body, we can't do stuff like that. We can't regenerate organs. Teeth are exactly the same. People might think that teeth are very simple, but when you look at the biology, it's absolutely amazing. The fact that teeth can outlast you. There's nothing that we have that can last that long, that can undergo that kind of load, that kind of extremes of hot and cold in milliseconds, those crushing loads in milliseconds, and then still not have stress fractures in it. There is no metal, there's no alloy that we can make as human beings, but your teeth can do that.
That is so interesting. And I think that's one thing you've always said to me as well, is you should always try and save a tooth if you can, rather than, just remove them, because, nothing is quite as equal as your own tooth. And of course, there are situations where it's necessary to remove teeth and put implants in. But I think your ideal is always, if you can, to try and save a tooth.
I think even when replacing implants, my approach is that it's with the understanding that we're trying to maintain everything else. So what I'm doing is to support everything. I'm not doing something which is superior to what was there. If I don't do anything, things will only get worse, because obviously there's a certain amount of support that we need. And when we're letting things fail, then you're just putting stress on the system, and then it won't last. Then whatever we're doing, the worse the situation becomes, the more of a compromise we're creating. So if we can deal with things when they're small, then that compromise is small.
What does that mean in terms, most people will be going for regular dental checks every year or so. But should we be doing this a little differently? Should we be more proactive? Should we be, I guess looking at things in a more proactive way than just those regular dental checks?
I think, and you and I have spoken about this over the years. Dentistry, when you're seeing your dentist, because you're going in for a short period, and this is the benefit of dentistry for everybody, is that there is no other medical experience that you're going to have that you're going to do regularly. Here, you're actually going in every 6 months, because it's you've been taught that, you've been educated to do that. So it's an opportunity for somebody to pick up something. And quite often, you know, we see patients, they come in, they're thinking that they're coming in for a dental health check, but we'll identify other things. We'll identify things which will maybe trigger like a visit to their general practitioner, maybe to get bloods, and that might highlight deficiencies which nobody would have picked up for a while until they had bigger problems. So you're saying, should we be doing something differently? I think one of the biggest issues that I always feel is that we deal with problems. We don't have a proactive approach. So even stuff that you're doing, Charmaine, which I find is absolutely amazing, and it's so important, is that people visit their general medical practitioner when they have a problem, but who's actually doing the screen? What if somebody actually did that screen regularly, like what we're doing? How many things could be picked up when they're very, very small issues? And you could correct them so that they don't actually need to have care.
That is interesting. And I think you know, we've also very often encountered situations where things like your dental implants fail as a result of some underlying condition as well. Could you say a little bit more about that? So, you know, if someone's coming in to do implants, are there certain things you'd want to make sure are in place so that we know that those implants are going to be more successful?
So the difference between normal dentistry or general dentistry and implant dentistry is that you are now working in bone. So the bone is going to interact in a different way. So the systemic health comes into play. Now, it's very important. And before, when implants weren't they weren't so mainstream, because they are really mainstream now. You know, it's something that's done every day. The amount of cases we would have done, the case selection would have been very, very controlled, just to ensure that we didn't have failures. But now, because in terms of the quality of life, you are improving somebody's quality of life by offering this care. So it's really important that you're able to offer to a wide scope of people, you know, a wide spectrum of people. But what we find is, as more and more cases are happening, we have much, much more data. So we can see that people who have underlying deficiencies can have an impact in the success of that procedure. It's no different than any other procedure. If you had a hip replacement, that surgeon might say to you, oh, I do 10 and out of that I get those failures. Well, what happened? Why did that one fail? What was the difference? So in our cases, it can be things like deficiencies like vitamin D deficiency, can be B deficiency, iron deficiency, thyroid dysfunction, diabetes. So we look at that HbA1c factor as well. So again, interesting, because I'm so, you know, we talk about this a lot. A lot of the screens that people get, if you look at your blood test, people will always say you're in the boundary of what's normal. What is that boundary? If you're just on the edge, is that normal?
Yeah, that's definitely it's something I speak to my patients a lot about. You know, is that bell curve of how reference ranges have been. You know, how did they come up with that range? Pretty much, you know, 90% of people have to fit into that range, and it is a bell curve, but it might not be the optimal. And so, yes, interpreting the data through, I guess, your personal situation as well, because you can't compare a 30-year-old pregnant woman with a 82-year-old male or a 17-year-old athlete. So, you know, looking at those reference ranges, you have to take them into consideration for each individual as well, and really look at not just kind of, like you say, creeping in on the edges of those ranges, but actually optimally sitting where it is ideal for your age and stage of life.
Then that scan, the blood screen that is done, is basically the picture on that day. So if you're right on the edge of that screen, that doesn't mean that you're always sitting in the norm. You might not be even on that curve on many days. I think one of the biggest learnings that I've had is the importance of vitamin D. Because the latitude that we live in, we don't get enough natural light. And even on a nice sunny day, you know, when we're seeing it's bright today, for instance, we're really covered up. So not a lot of skin contact to light, to natural light. And that means that we can have great deficiencies. And the other interesting thing with vitamin D is it takes time to build up in your system. So for you to actually have a benefit from it, it takes time for that to build up.
I would say nearly 80% of my patients that I test are vitamin D deficient.
I can believe that.
Yeah. And in Scotland, it's a huge issue. And actually, just this morning, I had a really lovely gentleman in, and his was way below the NHS standard range as well. And he said, well, but it's impossible because I play golf, 3 or 4 times a week. But then when we drill it down, first of all, like you say, we're so up north here in Scotland, the angle of the sun isn't great. But, then he said, oh, well, actually, I do wear long sleeves and a hat as well. So, even people who think they're outdoors a lot of the time can still be significantly deficient.
So another interesting thing, what is your take on sun factor? Because, when we go on holiday, we always go for the 50, because that's what we've been told. Now, if we're going on holiday, part of it is to get sunshine, isn't it? But at the same time, making sure that we don't cause damage to our skin. So what do you think about sun factor 50?
So it's a fine balance. So what I do when I go on holiday is I tend to not use any sunscreen in the very early hours of the morning. So I like to get out, get a little bit of, very early morning sun without any sunscreen at all. But then as the day goes on, our skins, especially if you've been living in Scotland for most of the year, and suddenly you're out in very harsh sun, of course, you can get burnt and damaged. So I will tend to put some sunscreen on around the middle of the day, or at least cover up, make sure that I'm in the shade or wear a hat. And then late afternoon sun again, as in the last couple of hours of the sun setting, you're safe as well. So it's really that midday sun that's we need to be careful of. And you do need a little bit of sun. So it's finding just that balance. And I guess everybody's skin tone is so different.
That's right.
There are some people who it doesn't take very much to burn, and for others who have got a bigger tolerance. So I think it's really going to be quite individual, knowing your body. But I try as much as I can to not use high factor sunscreens, unless, of course, we're out. You're in Greece at 1 o'clock in the afternoon in the middle of summer, and, you also don't want to burn. So it's just being sensible, I think.
Yeah. And vitamin D, I think people don't appreciate the importance of that. And you test for that quite regularly, don't you? What kind of issues do you find with people who are depleted?
So vitamin D is actually not a vitamin at all. It's a hormone.
Yeah.
And so the kind of issues we find it span across so many areas. I mean, typically we think of the immune system, first of all. With low vitamin D, there's usually low immune function, or even inflammatory processes. But it's so much more. It plays a critical role in our hormone production as well, in recovery and repair. So you mentioned earlier on surgery and vitamin D. And there has been some interesting studies around post-surgical complications and healing and infection. And a lot of that is not even so much the impact on the immune system, but vitamin D almost has slightly steroidal effect as well. So, it's a really interesting vitamin, hormone, or whatever you want to call it. There's tons of research on vitamin D and mood as well.
Yeah, absolutely. And even around COVID, it seemed to become quite popular with people. But yeah, I've read that as well. Yeah.
Yeah. There's interesting studies, linking, a whole lot of neuropsychiatric issues with vitamin D. So it is interesting. I have a lot more questions for you, but one of the things I want to talk about is the microbiome in the mouth. And I know people will be asking about this. So when we talk about gum disease and periodontal disease, does it mean dysbiosis? Does it mean the wrong kind of bacteria is thriving in the mouth? What does it really mean?
So everybody has bacteria. Obviously, a huge percentage of our body has synergistic bacteria, and this is part of our being. And we live quite happily with this. Now, interestingly, we've gone through this from the 70s where people didn't brush very well to now it's the other way around. We're very much into brushing well, flossing well, understanding this. I now have this again, this is not something that is part of what we're taught, but I have a question around this as to whether we should have some bacteria that we should not be shifting because it's commensal bacteria. It's actually good bacteria because we have that in our gut. Now, if we're trying to get rid of all that bacteria, surely some of that must have some positive impact on us. So we have something called pellicle, which forms on this on the teeth. It's like a skin, and it's a biofilm, and on that will attach bacteria. On that day or a few days, all of that's good. But as we leave that, the type of bacteria that takes over is much more anaerobic. So we're aerobic. We like oxygen, but for many organisms, oxygen is a poison. And the bacteria that thrive on anaerobic conditions are much more opportunistic. They're more disease-causing bacteria. So gum disease will attract that kind of bacteria. Now, we can all have that bacteria. It doesn't mean that you're going to get gum disease because there's many, many factors. So they believe that there's a switch which triggers in many people, which will then change that from gum, just having for gingivitis, which is inflammation of the gums, to actual gum disease. So gum disease is a disease which destroys the supporting structures of the teeth. It's not the teeth that it's damaging. It's destroying the supporting structures. And now why this is very problematic. So from a dental aspect, it means that you can lose your teeth. But from a more systemic problem, this is bacteria which is actually going into your bloodstream. So if you think about it, we have lots of safety mechanisms built into our body to protect us against opportunistic bacteria so that we don't get diseases. So we have skin, which is a fantastic barrier. We have very, very powerful acid in our stomach that if we put our hands into it, we would cause burns, but we live with that acid. But when you get gum disease, that bacteria is able to bypass all that because it can go straight through the skin around the teeth. It's called a pocket, and it can then infiltrate the bloodstream. So what they say is that if you were to look at gum disease, so it's called pockets. So when the hygienist goes around with that blunt probe, what they're checking is to see how deep they can actually go into it passively. If there are pockets, so say more than 2 millimeters, that's showing you that there's been a change, might be some inflammation. If they're going deeper, that means you've actually lost support because you must have lost attachment between the jawbone and the actual tooth. That environment's different. So if you were to open that up, it's like having an ulcer. And somebody actually postulated that if you were opening up these ulcers, this gum disease pockets, and if you had that on your arm, you'd be dead.
Wow.
Because you couldn't survive with such a large ulcer. But we're walking around with that large surface area of damage in our mouth.
Is that reversible? Is there anything people can do once they've developed, some of that loss of structure? Is it?
It depends on how far gone it is, like any disease process. So the important thing there, Charmaine, is it's early diagnosis. So that's why it's really important. People will say, oh, I don't have pain, so I didn't realize I had this issue or nobody told me. How many people do you hear about who've got cancer or some terminal disease and they tell you, I didn't know I had any issues. I went in and they told me that I've got this really serious thing. Pain is a protective mechanism. We never think of it like that. but it's there to tell you something's not quite right, but it doesn't always trigger.
Yeah, absolutely. Okay. So again, it just comes back to early detection and picking that up early.
Early detection. And I think the other thing, again, over the years, and grey hair teaches you a lot, because I think you do your professional training, but one of the best thing, and why it's called practice, when people talk about medical practice or dental practice, it's lifelong learning if you're open to it. And I think one of the things that I've realised is it's not just about visiting the hygienist. It's about seeing your hygienist more like your personal trainer. Your hygienist is not there to clean your teeth. It's not going to make a huge impact. What a good hygienist will do for you is they will help you try to maintain that. Just like your personal trainer, they're not picking the weights for you. You're doing that. They will make sure that you're on track. There's small issues. They're able to highlight that. You're able to finesse how you're going to maintain that so that you don't have the big issues.
I think that's definitely been my experience. And at your practice, that's where I go for my dental hygiene. And it's picking up little things like sometimes, the hygienist will say, you may not be aware, but you're actually missing an area when you're brushing, or, getting those little gum scores and saying, okay, you have to work a little harder in this area or that area has been so helpful, because I then know exactly kind of where I'm missing little bits and where I need to go in and focus, and, to make sure that I'm getting it right. So I think for me, that's been an incredibly valuable process.
Because it should be a collaborative, supportive role. It shouldn't be judgmental. I mean, it's amazing that people take the time to take responsibility for their health. And that's more and more, isn't it? We've been through generations where people would go and think it's somebody else's responsibility to make them well. But now I think people are much more aware, just with all the knowledge that's available. So they're much more proactive in finding out what they can do to fix things themselves.
Absolutely. I have a question for you about lasers. But before that, while we're still on the kind of microbiome issue, talk to me about mouthwash, because, a lot of people will be using quite harsh mouthwash to get rid of bacteria. Is that a good thing or a bad thing?
This is a very, very good question. So the analogy that I use is that if you want to clean something and you had flash spray, by spraying it will not clean that. You have to mechanically touch it. You need to rub it, and that's what's going to clean it. So this is no different when you're cleaning your teeth, it's the mechanical cleaning. So firstly, the fact that you touched it, you're going to remove the bacteria. Secondly, you're actually nourishing that tissue because you're touching it. So you're getting a better blood supply around it. So that's very important. Mouthwash, my personal belief is that there's no need to be using mouthwash. It's a chemical. We're introducing a chemical into our body that we don't really need to do. If you're doing good mechanical cleaning, so if you brush really well, that's 60% of the surfaces you manage to clean effectively. The other 40% is just by using something between your teeth, whether that's flossing or other aids. But if you do that well, you don't really need to do anything else.
Okay, I like that. And then lasers. Talk to me about lasers in dentistry.
So lasers is something that's really fascinated me for a very long time. And, we were talking about this, Charmaine, we've grown up in the era of Arthur C. Clarke and all this kind of science fiction. And if you look at a lot of the technology that they talked about in the 70s and the 80s, you're actually starting to see that happening now. So lasers are something like that. It's not science fiction. We can use lasers because lasers are basically just light. So one of the things that people worry about lasers is they think it's radiation. So just to understand, there's two types of radiation that we get. We get ionizing radiation and non-ionizing radiation. Ionizing radiation is like microwave radiation or other radiation which will actually impact the cells and destroy those cells. That's what causes damage to those cells. The lasers that we're using is actually non-ionizing. It doesn't do damage. Even though it's called radiation, it doesn't damage. When you come into interaction with light, your cells are nourished. It's a very gentle way of healing. So the big benefit of lasers, so I use a lot of laser technology for surgery as well. So yes, you can use scalpels, but using a scalpel is an assault on the tissue. Whilst with a laser, it's like a custom-made scalpel. So you're working at a cell layer level. So whilst when you make a cut, so if you made a cut on your hand, you go through the whole skin. With a laser, you can control the depths of that cut by how much energy you're actually using. That's the big benefit. But the biggest benefit of that energy is that whilst in one layer, you might be cutting, further down, there's something called PBM, biomodulation, which is a concept where as you're cutting, you're healing. So that energy is actually energizing your cells, and it's impacting something called mitochondria, which are the powerhouse of your cells. They're like the batteries. And what it does is it energizes that. So as soon as you get a cut, your body will go through a period of inflammation, and it's a healing process. But it has to go through this cascade. What the laser will do is it will impact that, so it can cut out some of that inflammatory curve. So we have many, many patients, and I do quite large surgeries for people, and they will tell you that they've had no discomfort the next day. Right.
It's quite incredible, isn't it? Because of course, with a scalpel, it's very invasive. You're damaging tissue. You know, you need to obviously do the surgery, but there is a large element of damage that happens. So you're saying with a laser, the damage is a lot less because it's very targeted. You can go in very specifically, but more than that, the laser, that photobiomodulation aspect of it actually gets cells healing. So you actually, and at the same time as doing the surgery, you're already starting the repair process.
You're kickstarting the repair process, and you're basically cutting out the inflammatory curve. Now, lasers have different wavelengths, so lots of different lasers will do different things. So you'll see industrial lasers can cut through metal. The lasers that we're using, they can cut teeth, they can cut bone, they can cut skin. So there's it's different things for different purposes. But there are certain wavelengths we know which are optimal for healing. So people can come in and they can have, so even yesterday I had one of our colleagues had back pain and shoulder pain, and they've been going to the physio, been to a chiropractor. I did a laser treatment for 3 minutes, and he was telling me today the pain had gone down so he's been living with 7 and 8. He hasn't been able to sleep properly, gone down to 4. This is day 1.
Wow, that's incredible. So lasers are not just for cutting. You can use them
It's healing.
for healing.
Yeah. And we were talking about it. It's amazing what's out there now. So they're using laser wavelengths for gut healing as well, and Alzheimer's, which I know you're very big into. But I was at a congress. They were talking about using laser beds, or light beds, or even diodes now, because this is the big thing at the moment. Where you can energize the tissue, you can get better blood supply, and you can have an impact on that.
Yeah, we did witness that in Germany a few years ago, when an experiment where they had EEG on regions of the brain, measuring brainwave activity, and then used lasers, and the change in those brainwaves was instantaneous and phenomenal. And I thought, when I witnessed this, I was like, there's no way that light can penetrate through the skull. I was stunned to see that. But I think in laser technology is coming on so much. So yeah, I mean, it sounds to me like that's the way dentistry needs to go, is to throw out the scalpels and start incorporating more laser technology.
I think so. The other way we can use it, so going back to gum disease, is that quite often when people have disease which is quite far advanced, the gums need to be peeled back. So they might go to a specialist. That person might then do more conventional treatment where they're removing tissue that tissue has been damaged. And what we're trying to do is we want to treat it in a very keyhole microsurgical way. So if you look at a lot of general medicine, it's going down the way of robotic surgery, keyhole surgery. Why are we doing this? People used to have heart operations. They would be out for 2-3 weeks. People can walk out the next day. It's now possible to do that. It's because you're trying to limit. Remember, what we're doing is repair work. So, but we're also causing pain, might be causing trauma to that tissue. We want to be able to control just our impact on that body as well. So with lasers, what you can do is you can actually penetrate that pocket without actually lifting the gum. And you can remove cell layers of tissue, which is infected. But at the same time, like what I was saying, because you're using a laser, you're going to get a PBM benefit as well. So you're energizing the tissue, you're improving the blood supply, you're kickstarting the repair process. At the same time, you've removed the infected layer so that you have a fresh surface, which will have high energy, and it will start to repair itself.
Yeah, that's amazing. So just to kind of summarize, because coming back again, this podcast is really about longevity and health span. So would you say that our oral cavity has an impact on our not just our how long we're going to live, but how healthy those years will be?
So the way I would put this is that you could have a gym bod. You could be going to the gym every day, but what you're putting in your mouth, which is the opening to the rest of your body, what the impact you're having in terms of how you're looking after that, it's going to have an impact on the rest of your health. So if your oral cavity is not in a good place, you've got inflammation, that's going to spread through your whole GI tract, and the biome is going to be impacted by that. So this is the whole thing that we're understanding now. Periodontal disease causes inflammation. We now know that chronic inflammatory disorders cause a lot more damage than what we understood before. We always used to think it was low key. Chronic inflammatory disorders like periodontal disease or gum disease mean that you have a higher risk of heart disease. For ladies, it can affect preterm birth. So in terms of baby's weight, it can have an impact. So they even can see Alzheimer's. We're saying that Alzheimer's is diabetes type 3.
Correct.
So blood sugars have an impact on gum disease. Blood sugars have an impact on Alzheimer's as well. And it can be working, bidirectionally as well. There's so much that we don't understand, but we're starting to understand. But we have a feel of what's going on. So when we have inflammation, we know that the pH is low of that tissue, which means it's going towards disease. What we want is we want a higher pH. We want a more alkaline pH because that's healthier.
So what would be your advice for people listening to this and thinking, what should I be doing? What are the key things? What are the main takeaways for people today?
I think your biggest investment in terms of dental care, I think, is hygiene. I always say that because it's preventative. It's the only thing we do which is preventative. So it's something, a lot of people think that they're going in for a clean. A good hygienist isn't doing that. If you're going in for a clean, then you're not getting the best benefit out of that. It's all those little indices that you were talking about. It's a collaboration. So that's the first thing. The second thing is vitamin D is very, very important. So it's really important to get checked on that. And I think also because you do a screen, I think that's really important that you get that done regularly. And in fact, I had a patient, one of our mutual patients yesterday, and she was extolling your virtues because she was saying there were so many things that you had impacted, which had really helped her and her husband. And she'd been suffering for quite a long time. And she'd had been to many, specialists, but they hadn't been able to pick that up. But what you had helped her with had actually reset everything. So I feel that, this is something that we do miss out in this country, this screening. The blood screening is very important.
And I think that collaborative work between, dental professionals and, health professionals, because it is a collaboration. We talk a lot to our cognitive clinic. We talk to our patients about oral health a lot because, the impact it has. So I think there has to be a stronger collaboration, happening between dental care and healthcare.
Yeah, absolutely.
Well, thank you so much for your time. I really appreciate it. I know how incredibly busy your practice is, so I'm very, very grateful for your time today.
Thank you very much, Charmaine. This is really nice to talk about this.
Take care.
Bye.